I want you to imagine you're sitting in a cafe with 4 of your close family or friends. Statistics tell us that one of you at that table will experience depression at some point during your lives. For that one person, there's a 2 in 3 chance that they won't receive the care that they need. This is the issue at the centre of my research. How do we increase the timely identification and effective treatment of common mental health problems such as depression and anxiety? And I think it's really likely that you've held a potential solution in the palm of your hand every day. Because the chances of everyone at your table owning a smartphone are really high. My name's Jennifer Nicholas. I'm a postdoctoral researcher at the Centre for Behavioural Intervention Technologies at Northwestern University. Along with my fantastic colleagues and under the leadership of David Moore, we're looking at how we can use smartphones to identify depression, but also how we can use apps to place mental health treatment and support right at people's fingertips. Depression is actually the leading cause of disability associated with disease globally today. For many, it's a recurrent disorder, and as well as feeling down, depressed, or hopeless, it's also associated with a number of behaviour changes. These are things like reduced sociability. Maybe one of your friends didn't make it to the cafe today. Things like disruption of sleep patterns, either sleeping too much or not at all. Or things like not getting as much activity. And this isn't just not getting out of the house, getting to the gym as much as you should, but really finding it difficult to even get out of bed. And a lack of interest in activities that you otherwise really enjoyed. There are effective treatments for mental health, but there's an unfortunate barrier between people actually getting the right diagnosis and then receiving evidence-based care. These are things like access. So can people actually get to a clinician within an efficient amount of time? Things like cost, but also the unfortunate stigma that still surrounds mental health today. We think smartphones can overcome many of these barriers. And the first way that we're looking at it is to try and help the identification of depression. So within your smartphone, there already exists a network of sensors. These are things like the communication logs, how many incoming and outgoing calls are made each day. Things like the GPS or the accelerometer. But even things like your screen activation time, is your screen on or off at any given moment, or the sound or light sensors. We're interested in how we can use data from these sensors to link up with the behaviours associated with depression that I mentioned earlier. It might not be terribly surprising to learn that actually a great predictor of your sleep patterns is whether your phone screen's on or off. But more than that, we're looking at how we can use sensors of GPS and accelerometry to really zone in on those movement and location patterns that are associated with depression. So let me give you an example. In a sample of 40 adults from across the United States, we found that movement and location were associated with depression. People who spent a lot of time in a very few locations were more likely to be depressed than people who spent just a little bit of time in a lot of locations. These differences between movement and location between individuals with depression and those without were found to be even more pronounced on the weekends. And if you think about it, this kind of makes sense. On the weekends, our schedules are such that our movement and location are less bounded by having to do things like go to work or go to school. What we also found was that there was a predictive ability of this data. So your movement patterns on the weekends were highly associated with your symptom severity scores for depression 8 to 10 weeks later. What we're interested in doing now is using larger, more diverse samples so we can continue to explore what passive sensor data can tell us about your mental health. But identification is only half the picture. We're also interested in how we can increase the accessibility and reach of mental health services. Over the past 10 years, the internet has been shown to, online programs for depression and anxiety have been shown to be as effective as face-to-face therapy. And with smartphones, we can now place those programs into the palms of people's hands so they can be used when and where they're most needed. We're looking at developing a suite of 11 apps. These apps are really just designed to be short and simple, really to be completed within 1 to 3 minutes each day. And completing them really helps develop skills that would otherwise be imparted during therapy. So for example, our app Thought Challenger. This teaches users how to identify and control negative thoughts, as well as maybe unwanted or intrusive thoughts. Our app Move Me really gets people to try and get out and about, encouraging exercise in just 10 to 15-minute bursts each day. And Slumber Time, which allows people to track and ultimately regulate their sleep patterns. In an open trial of these 11 apps, we found that their use was associated with a reduction in depression. We're now looking at how we can use in-app feedback and data visualization to continue this trend of reducing people's symptoms, but also make sure that these apps are engaging and useful to users. With these 2 lines of research, we aim to make sure that not only everybody has access to mental health treatment and support, but with smartphone sensors, with their predictive data, which allows us to do early intervention, we're aiming to keep everybody at your cafe table mentally healthy.